Does pain going down your leg mean you have sciatica? Sometimes. Pain running down your leg doesn't automatically mean you have sciatica. In fact, many people diagnosed with sciatica don't actually have pain caused by irritation of the sciatic nerve at all. The term sciatica has become the low back equivalent of saying someone slept wrong. It's an easy label, it's lazy, and it's often inaccurate. One of the biggest misconceptions in musculoskeletal healthcare is that all pain traveling down the leg is sciatica or a pinched nerve. In reality, many different tissues can create pain that is felt somewhere other than where the problem actually exists. This is known as referred pain. Muscles, joints, ligaments, discs, and nerves all have predictable referral patterns. Some refer pain into the glutes, others into the thigh, and some can even reproduce pain below the knee and into the foot. The important thing to understand is this. Pain tells you where you feel it, but not necessarily where it starts. Just because pain travels down the leg doesn't automatically mean a nerve is being compressed or that the sciatic nerve is the source of the problem. What is true sciatica? True sciatica occurs when the sciatic nerve itself becomes irritated or compressed, and that's hard to do. This type of pain often has distinct characteristics, including, but not limited to, burning or electric pain, sharp, shooting pain that follows the path of the nerve, numbness or tingling, muscle weakness, changes in reflexes, symptoms that frequently extend below the knee and into the foot. While these symptoms can occur with true sciatic nerve involvement, they don't describe all people with pain going down the leg because not all pain down the leg is sciatica. A muscle can refer pain, a joint can refer pain, a ligament can refer pain, a disc can create symptoms without directly compressing a nerve. Understanding these referral patterns helps explain why so many people are mistakenly told they have sciatica. Muscles refer pain when they develop trigger points, those things that hurt when you push on them, those are knots, and those refer pain from one place to another. For example, the glute medius in your hip commonly refers pain down the outside of the leg, mimicking SI joint pain, or sciatica. The piriformis can refer pain into the glute and down the back of the leg, sometimes all the way into the foot and toes, mimicking sciatica. These referral patterns can closely mimic sciatica, even though the sciatic nerve isn't actually involved. Joints can refer pain too. Joints are another common source of referred pain. The sacroiliac joint, SI joint, is one of the largest joints in the body. It frequently refers pain down the glute and down the outside of the thigh, typically stopping around the knee. The small facet joints, which are the joints of the spine, the facet joints of the lumbar spine, commonly refer pain into the glute and the low back. Neither of these conditions necessarily involves irritation of the sciatic nerve. Discs refer pain too. Perhaps the most misunderstood source of referred pain is the intervertebral disc. Many people assume a disc can only cause pain if it's pinching a nerve, and that's not true. A disc can be painful on its own and create referral patterns even when there is no nerve root compression. In fact, the L4-L5 disc and L5-S1 disc, two of the most commonly symptomatic levels in the lumbar spine, can both refer pain into the glute and down the leg. That is one of the classic referral patterns of an irritated lumbar disc. Just because pain travels into the leg doesn't automatically mean the sciatic nerve is being compressed. Sometimes the disc itself is the painful structure. Well, is every pinched nerve really sciatica? No. Another phrase that's become overused is pinched nerve. Yes, nerves can become compressed or irritated, but not every radiating pain is caused by a pinched nerve, and even when a lumbar nerve root is compressed, calling it sciatica isn't technically accurate. Why? Because the sciatic nerve isn't a single nerve root. The sciatic nerve is the largest nerve in the body. It's formed by the joining of multiple nerve roots, primarily L4 through S3, within the lumbosacral plexus. These individual nerve roots merge together before forming the sciatic nerve that exits the pelvis and travels down the back of the leg. If an MRI shows compression of a single nerve root, such as L4, L5, or S1, the diagnosis is more accurately described as the lumbar radiculopathy, not irritation of the sciatic nerve. Many healthcare providers use these terms interchangeably, and most patients are far more familiar with the word sciatica than lumbar radiculopathy. And while that's understandable, the distinction matters because not all pain traveling down the leg is sciatica or a pinched nerve. A muscle can refer pain down the leg. Your SI joint can refer pain down the leg. A disc can refer pain down the leg. A compressed nerve can refer pain down the leg. The sciatic nerve can cause pain down the leg. Finding the true source is what matters. So how do clinicians begin to tell the difference? Well, there's a lot of ways. We don't simply ask where the pain is. I mean, that is a question, but there's multiple things to consider. How does it feel? Is it burning, aching, sharp, dull, or electric? When does it occur? What movements make it better or worse? Can pain be created with orthopedic testing? Can pressing on a muscle or a trigger point reproduce the symptoms? Are there neurological findings such as numbness, weakness, or altered reflexes? Each of these clues helps determine whether the pain is coming from a muscle, a joint, a disc, a nerve, or some other structure. The goal isn't to give the pain a catchy name. The goal is to identify which tissue is actually responsible. This is why the correct diagnosis matters. If the diagnosis is wrong, well, guess what? The treatment is often going to be wrong. Many people spend months stretching their hamstrings, trying to release their sciatic nerve, or buying products marketed for sciatica when the sciatic nerve isn't actually the problem. Instead of asking, how do I fix my sciatica? Ask a better question. What's actually causing my pain? Pain tells you where you feel it. It doesn't always tell you where it starts. That's why a thorough examination and a movement assessment are so important. The goal isn't simply to put a label on your symptoms, it's to identify the issue that's actually responsible. Because labels don't fix problems. Finding the source does.